My name is Marla Mahon. I am a physical therapy clinical coordinator at Carolinas Rehabilitation in Charlotte, North Carolina. We're part of the Carolinas healthcare system, which largely serves North and South Carolina. Carolinas Rehab has 4 facilities, inpatient facilities, one in Charlotte, one in Concord, one in Mount Holly, and one in Pineville. And we serve patients who have had brain injuries, spinal cord injuries. We have an oncology service, and then we also serve patients who have had strokes and other conditions which require inpatient rehabilitation. We also have a system of outpatient clinics in the area as well. This is my 3rd conference here with the TBI Model Systems Leadership Forum. I feel really strongly about this group of people because we are actually the folks on the front lines. We are managers, some administrators, but we also have a connection with the patients, which I think is really important, and we can really affect some change in our facilities. So I think one benefit of this group is us sharing information with each other, asking, what's working well for you, what's not working well. I can come to this group with something we may be struggling with in our facility and get some great ideas, try to implement some things, and then go back and share that information with the group. It's also really great if after you've given a talk about something that you might be doing at your facility, when someone comes up to you and says, that's a really great idea, or can you share some more information about that. I think it also kind of validates some of the things that you're doing when you have this other group of people from top-notch programs coming and asking for your feedback. There is a lot of change going on in healthcare, and I think it's going to drastically affect the rehabilitation that we're able to provide to patients with traumatic brain injuries. I think that we need to try to look at it as an opportunity to become more innovative, to have the frontline clinicians really drive the research that we're doing to find out what works, what should we be spending our time doing, what are some things that we really need to focus in on to make sure that we're providing the best care to our patients. And I think everyone gets into healthcare to really do the best for our patients, and I think that some of the healthcare reform kind of puts some constrictions on things in some ways, but in some ways it's going to be beneficial, and we just really need to work together to figure out what's really going to be the best process for still providing that high level of care that we need to for our patients. I think over the years I've gotten a lot of different ideas from this group. Things from how to best provide education to our patients, ideas about how to be good leaders for our staff and be able to really support them so that they can provide the best quality of care for our patients. We just listened to a talk about social media, and it did give me some ideas about how we could maybe use that platform a little bit more efficiently, especially given the younger population that we're starting to see coming through with these traumatic brain injuries, and really getting in touch with how are they using social media and how can we incorporate that into our practices.